today on a hearing that I consider to be very important, and we especially want to thank our panel of expert witnesses, and a special thanks goes to Congressman Elijah Cummings. Congressman Cummings and I have been working on this issue together for quite a while now, and I very much appreciate all the efforts that he has made in the House, and we're going to turn to the Congressman in a few minutes. The issue that we are discussing today is of huge consequence to the American people. When we talk about health care, we are talking about the need of the American people to be able to afford the medicine that their doctors prescribe. That's pretty commonsensical. Unfortunately, however, drug prices in this country are, by far, the highest in the world. Because the United States lacks a national health care program which is able to negotiate with the pharmaceutical industry, drug companies are able, in many cases, to charge any price they want for their product. And people see time and time again, they walk into their pharmacy and the price of their medicine has gone way up, no particular explanation for that. Today, according to the most recent reports, more than 1 out of 4 Americans do not fill their prescriptions because they cannot afford the cost. Think about that for a second. People walk into the doctor's office because they are sick. They or their insurance company pays for that visit. Doctor spends time with them. The doctor diagnoses the illness. The doctor writes out a prescription, and 1 out of 4 people are unable to afford to fill that prescription. What happens to those people? They go home, their illness continues, maybe they end up in the hospital. Totally absurd situation. All of us understand that one of the important breakthroughs in medicine in recent years is the advent of generic drugs. And what that means is that while protecting the intellectual rights of the company that developed a drug, the patent expires at a certain point, and that drug can then be manufactured by other companies. And that's what generics are about. The result of that has been that millions of people are purchasing generic drugs at far lower prices than the same drug sold under a brand name. And more people use generic drugs, and that is, to my mind, a good thing. And this has been an enormously helpful development in alleviating illness and suffering. The purpose of this hearing is to take a hard look at the generic drug industry and to make certain that generics remain affordable to the patients who need them. Because if that does not happen, if generic drug prices continue to rise, then we are going to have people all over this country who are sick, who need medicine, and who simply will not be able to afford to buy the medicine that they need. On October 2nd, Representative Cummings and I launched an investigation into the price increases of 10 generic drugs. Now, as it happens, the manufacturers, the companies who manufacture these drugs, have complained that we just cherry-picked a handful of drugs that have seen the largest price increases. And they said, that's not really fair. You only picked it on a few drugs. But in my view, that criticism is not valid. While we are focusing on 10 individual drugs that have seen extraordinary price increases, what we are also seeing in the industry is that many other generic drug prices are rising as well. And by the way, I should mention here that according to a November 10th article in the Wall Street Journal, some of the price increases that we are looking at this hearing and the companies involved are being investigated by the U.S. Department of Justice for possible violations of antitrust laws. Now, according to Medicare and Medicaid data, between July 2013 and July 2014, half of all generic drugs went up in price. During this same time period, over 1,200 generic drugs, nearly 10% of all generic drugs, more than doubled in price. More than doubled in price. In fact, these drugs went up in price by an average of 448%. Dozens of drugs went up by 500, 600, 1,000%. So to say that we're just looking at 10 drugs is not accurate. There appears to be now a trend in the industry where a number of drugs are going up at extraordinary rates. Let me just give you a very few examples, and I'm probably going to mispronounce half of these drugs. From July of 2013 to July of 2014, the price of pravastatin sodium, which is used to treat high cholesterol, went up 577%. The price of divalproex sodium, a migraine medication, went up by 797%. The price of digoxin, a medication used to treat congenital heart failure, went up by 828%, et cetera, et cetera. Now, let us be clear that these huge increases in generic drug prices not only drive up healthcare prices throughout America, which is a huge issue, but they impact the lives of very real people, many of whom are struggling economically. And if you don't have a whole lot of money and you go to the drugstore and the druggist tells you that you're now going to be paying 10 times more for a medication that you need, this has a huge impact on your life. Maybe you don't get the food you need. Maybe you don't heat your home the way you should because you don't have the money to spread around. Several months ago, on my website, I asked people in Vermont and throughout the country to tell me what this increase in drug prices meant to them. What did it mean to them? And we got some 1,600 responses. Don't worry, I'm not going to read all 1,600 of them, but I will mention just a few, if I might. Barbara Heller, who wrote in through my website, and it was featured last week on a CBS news program, has an autoimmune disease, and she recently saw the price of her generic drug, Orsodiol, increase from $95 to over $1,200. Although she eventually found a lower price, it was still over 3 times what she previously paid. North Carolina pharmacist Parks Thomas said on April 9th, 2014, and I quote, "I have been a pharmacist for 30 years, and I've never seen increases like this, never," end of quote. According to Thomas, antifungal creams that used to cost $5 now cost $77. The cost for a bottle of doxycycline went from $3 to $135. The antidepressant clomipramine that used to cost $35 now costs $605. The goal of this hearing was pretty simple. It was to have some witnesses come forward to give us their understanding of why drug prices had gone up and to hear from the manufacturers. Congressman Cummings and I and others wanted to know why it is that over the course of a year, the price of these drugs have gone up not 5% in some cases, but 500%. Not 10%, but 1,000%. We wanted to know if there was a rational economic reason as to why patients saw these huge price increases, or whether it was simply a question of greed, of companies who were able to raise prices to whatever level they wanted, and that is in fact what they did. And those are the questions that we wanted to ask to a number of drug companies. Unfortunately, not one of the companies that we asked to testify today chose to come to respond to those questions. We invited 3 companies, Lannett, Teva, and Marathon, and I am disappointed but not surprised by their refusal to show up here. Let me conclude by saying that Representative Cummings and I have introduced legislation that will address one part of the problem. The bill we are introducing will require generic drug companies to provide a rebate to Medicaid if their drug prices rise faster than inflation. Brand name drugs are required to pay this rebate if their drugs go up faster than inflation, but generic drug companies are exempt. Congress should fix this loophole immediately.